Hello dear candidates. So today we'll study the management of different types of headache. So the third one is acute bacterial sinusitis. You have to first explain the bacterial sinusitis, right? So tell them that it is the infection or inflammation of the sinuses. What are sinuses? So sinuses are actually the small air filled spaces in the bones of our space, which usually help us in filtering and humidifying air, right? So they can get blocked, inflamed or infected, and then you get the symptoms of bacterial sinusitis, right? Such as pain, pressure or greenish nasal discharge. So in terms of management, you have to first check what is the duration of the sinusitis. If it is more than 10 days, so it's bacterial sinusitis and you have to start a treatment. In the treatment, you have to mention that you will give them the antibiotics such as phenoxymethylpenicillin for 5 days. If they are allergic to the phenoxymethylpenicillin, so you have to give them any suitable alternative, right? You also have to give them prescribe them the nasal steroid spray. It actually reduces the swelling in the sinuses and improve the drainage. As far as other symptoms, you have to give them the painkillers such as ibuprofen or paracetamol, which relieve the pain as well as lower the fever, right? uh, Additional care, you also tell them that you suggest them that steam inhalation, tell them that to drink plenty of fluids, stay hydrated and avoid overuse of the nasal decongestant, right? Why to avoid the use of overuse of nasal decongestant? Actually, because it can worsen the symptoms if it is taken for the long term, right? Then safety netting, tell them that if the symptoms worse after starting the treatment, or if there is no improvement in the 48 hours of the starting treatment, so you have to seek medical help. Or if you notice any other changes such as severe fever, neck stiffness, all this, right? So tell them that you have to seek medical help and then follow up. Follow up plus you have to give them the leaflet, right? Then is subarachnoid hemorrhage. It is also very important, right? So for in the subarachnoid hemorrhage, you have to explain them the definition. You have to explain them it is in a very simple words, right? So tell them that it is the bleeding into the spaces around the brain, right? Actually there are small tell them that there are small weakened blood vessels. They can get burst, right, from severe high blood pressure, or there may be any hidden aneurysm. They can get burst and then blood can go into the spaces around the brain, right? And it presents as a very severe headache, a very sudden and extremely severe headache, right? And it is a medical emergency. You have to admit the patient into the hospital for urgent investigation or specialist care, such as for neurological care, right? Okay, if you are in GP and a patient presents to you with a subarachnoid hemorrhage, so you have to arrange an you have to arrange the ambulance in on emergency basis, right? Okay, and if you get a case of subarachnoid hemorrhage via telephone call, so you have to call the 999 to arrange an ambulance for the patient, right? The patient may tell you that they want to go hospital by their own or with their friend, so tell them that it is not safe to go by own or with a friend, right? As the symptoms can worse suddenly, and in the ambulance there will be a team to monitor your vitals, and if anything happens, they will manage accordingly, right? Never give the patient aspirin, right? As far as initial treatment is concerned, you have to give them the morphine, it is a strong painkiller. You have to give them IV, and also along with that you have to give them the nimodipine, right? Nimodipine for the neuroprotection. Actually, in the subarachnoid hemorrhage, there is severe high blood pressure, and to reduce the complications, you have to give them the nimodipine, right? In the hospital, certain investigations will be done. You have to mention all the BLIs, blood tests, organ function tests, inflammatory markers, all these. Then urgent CT brain will be done, right, to check for any bleed, right? If this is urgency brain is very important, right? If on the CT there is no blood in the CT or in the brain, so then you have to do the lumbar puncture to test the spinal fluid, right? To check the spinal fluid for any blood changes, right? Then once bleeding is confirmed, so you have to refer the patient to the neurosurgical team. Mostly they can manage them as conservatively or through coiling or clipping. They can also manage the patient via these two procedures, coiling and clipping. Do mention these procedures, right? Then safety netting. In the safety netting, you have to tell them that during the transfer to the hospital or all these, right? If you get any severe symptoms, seizures, nausea, severe vomiting, all these, so you have to inform the ambulance team. They will monitor you and they will manage you. In the follow-up, you have to tell them that you will be followed up by the stroke or neurological team, right? So this one, and you in the end you have to give them the leaflet which contains all the information of the subarachnoid hemorrhage. Thank you. Keep following me. Bye.